As a heart surgeon with decades of experience, I've seen countless senior patients come to me worried about chest pain, shortness of breath, or sudden fatigue. Often, the real culprit isn't diet or stress, it's a medication they've been taking for years, sometimes even one that was originally prescribed to help another condition. What many older adults don't realize is that certain common prescriptions, taken daily by millions over 60, can quietly weaken the heart muscle, raise blood pressure, or trigger irregular heartbeats. These side effects often go unnoticed at first, but over time, they can put serious strain on your heart and even shorten your life expectancy. In this video, I'll expose 7 medications that may be harming your heart without you knowing it. This isn't about spreading fear, it's about awareness and empowerment. If you or someone you love is over 60 and taking medications for pain, sleep, blood sugar, or mood, you need to watch this until the very end. Pill number 1 is the most dangerous and also the most widely used. I'm not asking anyone to stop their prescriptions without consulting their doctor, but you deserve to understand what might be happening inside your body. So let's begin with pill number 7. Pill 7, non-steroidal anti-inflammatory drugs, better known as NSAIDs. These include medications like ibuprofen and naproxen, commonly taken for arthritis, joint discomfort, or back pain issues almost every senior faces at some point. Many older adults take them regularly without realizing how harmful they can be to the heart. NSAIDs can raise blood pressure and cause fluid retention, which adds extra strain to your cardiovascular system. For an aging heart, this extra workload can be enough to trigger heart failure or irregular rhythms. Over time, they may damage blood vessels and reduce kidney efficiency, further stressing your heart. If you're already on heart medication or dealing with high blood pressure, these drugs can quietly counteract your treatment. That's why I always remind my senior patients to never take painkillers long-term without guidance. There are safer options that don't carry the same heart risks. Pain relief is important, but not at the expense of your heart. Pill 6. Certain diabetes medications known as thiazolidinediones. If you're managing type 2 diabetes, you might know drugs like pioglitazone. They're designed to lower blood sugar but can cause fluid buildup, swelling, and heart failure, especially in seniors over 60. While these medications effectively manage glucose levels, they can create a hidden burden on your cardiovascular system. Many seniors with diabetes already face increased heart disease risks, and adding fluid retention only worsens the danger. Even more concerning, these drugs can disguise early warning signs of heart failure like fatigue or shortness of breath. Some doctors still prescribe them because they work well for blood sugar, but if you have any history of heart problems, you should discuss alternatives. Managing blood sugar is crucial, but not if it comes at the cost of your heart's strength. Pill 5, sleeping pills, or sedative hypnotics. Many seniors struggle with insomnia and rely on drugs like zolpidem or older sedatives such as diazepam. While they promise restful sleep, they can slow your heart rate and blood pressure too much, interfering with your body's natural nighttime rhythms. Over time, these medications can worsen or even cause sleep apnea, a condition where breathing stops briefly during sleep. This puts immense strain on the heart, leading to irregular rhythms or dangerous oxygen drops. Additionally, these pills can blunt the effects of important heart medications, such as beta blockers, making them less effective. Seniors are also more prone to confusion, falls, and breathing issues when taking sedatives, especially in combination with other prescriptions. Good sleep matters, but dependency on sedatives can slowly damage your brain and heart. It's wiser to explore natural sleep strategies or milder aids under professional supervision. Pill 4, tricyclic antidepressants. These are older medications like amitriptyline or nortriptyline, often prescribed for depression, anxiety, or chronic pain. Though effective, they come with a range of heart-related side effects: irregular heartbeat, sudden blood pressure shifts, and even conduction problems that disrupt your heart's electrical system. For seniors with existing arrhythmias or slower heart rates, these drugs can be particularly dangerous. Even at low doses, Prolonged use without monitoring can lead to complications. Some physicians continue prescribing them out of habit or cost concerns, but there are newer antidepressants that are far safer for older adults. If you're on one of these medications and experience dizziness, heart fluttering, or fatigue, don't ignore it or bring it up to your doctor right away. Your mental health matters, but so does your heart's safety. Pill 3. Decongestants such as pseudoephedrine and phenylephrine, which are common in cold or allergy medications. These might relieve stuffy noses, but they constrict blood vessels throughout your body, not just your sinuses. That means higher blood pressure and more work for your heart. For seniors with hypertension or heart disease, this added strain can be risky. These drugs can also cause palpitations, nervousness, and dizziness. Many people assume over-the-counter means harmless, but as we age, our tolerance changes dramatically. Something that felt fine decades ago could now endanger your heart. Always read medication labels carefully and consult your doctor before taking decongestants. Before we continue, a quick but important note: if you're over 60 and on any regular medications, consider downloading the Senior Health Tracker app. It's specifically designed for older adults to record prescriptions, track symptoms, and spot potential warning signs early. Most health apps aren't built for seniors, but this one focuses on medication safety and heart protection. Access is limited due to high demand, so don't check the link in the pinned comment or description box and take control of your heart health today. Pill 2. Proton pump inhibitors, or PPIs, like omeprazole and pantoprazole. These are commonly used for acid reflux or heartburn relief. They seem harmless, but long-term use can increase your risk of heart disease. PPIs block stomach acid, which helps with reflux but prevents your body from absorbing important nutrients like magnesium. Low magnesium levels can cause irregular heartbeats, fatigue, and even muscle weakness. Over time, PPIs also alter gut bacteria, leading to inflammation that contributes to cardiovascular issues. Seniors who take these daily for years are at much greater risk. If you've been on PPIs for more than a few weeks, it's worth re-evaluating with your doctor. Find and treat the root cause of heartburn instead of masking it indefinitely. Finally, Pill 1. Calcium channel blockers. These are prescribed for high blood pressure, chest pain, or heart rhythm disorders. Older versions like verapamil diltiazem can be particularly problematic for seniors. While they help relax blood vessels, they can slow your heart rate excessively, causing fatigue, dizziness, or fainting. In some cases, they lead to swelling, shortness of breath, and rhythm disturbances. They can also interact with other common medications, compounding their side effects. The biggest problem is that many seniors are prescribed these drugs for years without close monitoring, and the resulting fatigue or swelling is often blamed on aging rather than the medication. If you're on a calcium channel blocker and notice any of these symptoms, talk to your doctor about safer, modern alternatives. To wrap this up, if you're over 60 and taking any of the medications discussed today, don't stop them abruptly, but do have an open conversation with your doctor. These drugs were developed to help, but when taken long-term or without monitoring, they can quietly undermine your heart's health. In my years as a surgeon, I've seen far too many seniors hospitalized not because of their conditions, but because of the unintended side effects of their prescriptions. Prevention begins with awareness. With proper guidance, you can protect your heart, live longer, and feel stronger. Use tools like the Senior Health Tracker app to monitor your health, log your medications, and stay one step ahead of potential risks. The key is not fear but knowledge and action. Stay informed, ask questions, and never assume your medications are harmless simply because you've been taking them for years. Your heart has worked faithfully for decades. It deserves your protection and attention now more than ever. If this video helped you, please share it with your loved ones and subscribe for more life-saving health advice made especially for seniors. Stay informed, stay proactive, and above all, stay heart strong. A currency I diaresis sedilla.